Welcome to the IntelliLearn video library, Paediatric Weight-Based Oral Liquids, Examples, Part 1. Prior to administering a paediatric dosage, 2 checks must be performed. The first check involves ensuring that the value in the dose calculation box on the order is within an acceptable range for the medication in question. You can do this with reference to the Paediatric Pharmacopoeia or another reliable and current source. In this case, you are giving ibuprofen at 5 mg per kilogram per dose, which is an acceptable rate of dosage. The second check involves ensuring that the child's weight multiplied by the dose calculation is equal to the dose to be given, which is shown in the dose box on the order. In this case, the child's weight is 11 kilograms, which when multiplied by 5 mg per kilogram per dose is equal to the ordered dose of 55 milligrams. Both checks have shown no errors, and since a medication order is also valid in that it contains all of the essential information and is clear and legible, you can now perform the calculation. To do this, you need to identify the dose that the patient must receive in grams, milligrams, or micrograms. This information is always provided on the medication order in the box labelled dose. You also need to know the strength, which is also known as a concentration, of the medication in question. This information is printed on the medication as 2 numbers, separated by a / sign or sometimes a word per. The first number is a stock strength and the second number is a volume in mils. Once you have this information, you can calculate the volume to administer, which is equal to the dose that has been ordered divided by the stock strength multiplied by the volume over 1. Let's now replace each of these quantities with their actual values by reading the medication order and the strength of the medication. The dose that has been ordered can be read directly from the medication order from the box called dose. The dose box specifies how much active medication the patient must be given in each dose. In this case, it is 55 milligrams. The stock strength can be found in the concentration of the medication. It is the first numerical value before the / sign. In this case, it is 20 milligrams. The volume can also be found in the concentration of the medication. It is a numerical value after the / sign and always specified in mils. In this case, it is 1 mil. The required calculation is shown. Before actually calculating the volume to administer, it is good practice to estimate the answer. You can do this by considering the dose required and the concentration of medication. The strength or concentration of the medication specifies how much active medication, in this case ibuprofen, is contained in a given volume of solution. 20 milligrams per 1 ml means that every 1 ml of solution contains exactly 20 milligrams of ibuprofen. In other words, if you were to administer 1 ml, the patient would receive exactly 20 milligrams of ibuprofen. Therefore, if you were to administer 2 ml, the patient would receive 40 milligrams of ibuprofen, and similarly, a dose of 3 ml would result in 60 milligrams of ibuprofen. For this order, the patient must receive 55 milligrams of ibuprofen, and therefore you know that the volume to administer is between 2 ml and 3 ml. To perform the calculation with a calculator, you simply need to enter 55 divided by 20. There is no need to multiply by 1, as this will not affect the final result. Just press equals and the calculator will display an answer of 2.75. The 5 ml oral syringe that is available has increments of 0.1 ml, and so you must choose the closest increment to 2.75 ml. The correct answer is 2.8 ml, which is a required volume to draw up and administer orally. This also falls within the estimated range of between 2 ml and 3 ml found earlier. Please note that in your workplace, paediatric dosages may be expressed and/or rounded differently than demonstrated in this video. In your workplace, you must become familiar with and follow any and all guidelines and protocols that are provided.